We are good. Hi, everybody.
Hello, hello.
We're just waiting before we get started with all the meat and potatoes. We're waiting for some people to join on in here. So welcome to Dive Deep into Your Digestion. It sounds like a funny way to say it.
I know.
How long do you think you want to wait, Dr. Jess, before we get started?
Oh, maybe just 1 or 2 minutes, and then
if you guys are jumping on if you guys are jumping on right now, put a comment below. Let us know that you can hear us. Let us know that you can see us, so that we make sure you guys get the best experience here on here. We see people jumping on now, so make sure you comment and say hello and tell us that you can see us. So. Hopefully they can hear us. Yay, Kathy. Hi, Kathy. Good afternoon.
Hey, Kathy.
Great. Thanks, Julie. Hey, sound and visuals are good, so we are
Perfect.
Good to go. That's awesome.
Cool. Well, should we go ahead and get started?
Betcha.
Hi, Diane.
Good afternoon.
Welcome. Awesome. Well, thank you so much to everybody joining us, either live today or in the replay. So Dr. Abby and I are both really excited to just have this. Hey, Nora, thanks for coming. Just to have this discussion with you guys. And it's really, we're going to be doing a lot of talking, and then, like we've mentioned at the end, we're going to have a live question and answer session. So as your questions come up while we're discussing things, definitely throw that in the comment section, and then we can kind of go through that stuff to wrap up the presentation here. And so, yeah, Dr. Abby, do you want to go ahead and share the slides, and we can just jump into it?
Gotcha.
Perfect. So today's discussion is, again, a deep dive into digestion and your health. And I'm Dr. Jess, and I am a clinical pharmacist. And that's kind of how I started my career in wellness and healthcare. And through my practice as a clinical pharmacist, I have witnessed firsthand the inadequacies of our standard healthcare system, and really developed a passion for a more holistic approach to wellness. And so because of that, I've started studying to become a nutritional therapy practitioner to kind of add to my knowledge about holistic health and using food to help people heal, and then have since opened my own women's wellness practice, where I focus on helping women heal their relationship with their bodies and their relationship with food. And really a big piece of that is trying to educate on how the body works and optimize digestion. And we'll dig into the details of that in a little bit. But this discussion that Dr. Abby and I are having today really relates back to the work that I do with clients. And so that is me. Dr. Abby, do you want to introduce yourself?
You betcha. Hi, everybody. My name is Dr. Abby Tebby. I am a Max Living chiropractor. I have been practicing chiropractic for over 13 years now. I do operate and own my own business called Health From Within. And obviously, as you can see, that I have, not only am I a business owner, a chiropractor, but I'm also a mom and a wife. So I lead a pretty busy life. Part of what I love about, like Jess was saying, of just allowing our bodies to heal naturally. My office and my practice is all designed not only to adjust and take care of the spine, but also to help people get well and heal from the inside out. Honoring, what I always say is honoring the system, honoring the power that God put inside of our body, just nourishing it well and knowing that and trusting it that it'll do well. So kind of fun fact about the both of us, I actually met Jess while I was doing corporate wellness lunch and learn, and she sat smack dab in the front row, and she was awesome. And our we just really clicked and we really vibed. And what's really fun about this is that even though we are two totally separate people and we do separate things with honoring the body, our philosophies, our mindsets, and the science behind what we do are exactly the same. And I think that's when we started kind of collaborating or talking, it was like, we need to just help each other and the clients and the patients that we have kind of come together with all of this. And so this is how this all started. So I'm super excited to be able to be with you guys for this next hour and just lean into us, ask questions, and let us help you kind of get well from there. So that's a little bit about me.
Perfect. So we've kind of already introduced this, but I really wanted to be able to give you guys some background about, like, why are we talking about digestion? How does that relate to chiropractic medicine? How does that relate to nutritional therapy like I do? And one quote that I pulled from way back in the history books was Hippocrates, who once said that all diseases begin in the gut. This is mostly true. And that's related to the fact that our gut, or our digestive system, is really responsible for taking everything that we consume and then breaking it down into smaller pieces and building blocks to create us, to create our physical bodies. And so if our digestive system is not functioning properly, we're not able to take all the proteins and the carbohydrates and the vitamins and minerals that we need out of our food to have really healthy cells, really healthy tissues, and then really healthy organs. So I think a lot of the time we think about digestion from just like, does my stomach hurt, or am I having diarrhea or constipation? But it's really affecting the entire bodily system. And I also want to make a key point here, that is, a lot of times we think of the saying, we are what we eat. And I actually prefer the saying, we are what we absorb, because there are some scenarios where our digestive system is so out of balance. We can be eating all of the right foods, but if our digestion isn't working properly, we're not able to break those down and take all of those nutrients and incorporate them into our cells. And so I love to talk about wellness from kind of thinking about the smallest pieces of your body, and that is on the cellular level. And so really we are trying to make sure that our bodies, our digestive system is able to take, again, all of those wonderful nutrients that we put in it and assimilate it, break it down, and turn it into healthy, well-functioning cells so that our bodies are ultimately working appropriately. And so if you want to go to the next slide, Dr. Abby, I know we often think about, again, digestive issues as presenting with a certain set of symptoms. So we might think of, like I mentioned, your stomach is upset, you might have some diarrhea, even heartburn or indigestion, irritable bowel syndrome. Those are all kind of more obvious signs that you have some disorders in your digestive system. But realistically, and this again relates back to that old quote that all diseases begin in the gut, realistically, there are a lot of other symptoms that can occur in our bodies that are related to our digestive system not being able to break down and utilize all the nutrients that we're taking in. So some examples of those things can be hormonal imbalances, allergy symptoms, and then even thinking about, like, on that organ health level, thinking about how well is our liver functioning or our heart functioning. All of those systems in our body, again, need nutrients in order to function properly. And so I wanted to take a moment here too for both Dr. Abby and I to kind of dig into how we see issues in digestion present in our different practices, because we do practice differently with the same philosophy, like Dr. Abby mentioned. Some of the things that I see most commonly with the women that I work with are period problems. So like really painful menstrual cramps or PMS type symptoms, really heavy periods, maybe they're actually missing their periods. So those are really common and actually really related to certain nutrient deficiencies. So symptoms, again, related back to how well is your digestion working. I also work with women healing their skin. That's part of my health story, is that I have a long history of dealing with an inflammatory skin condition called seborrheic dermatitis. It's a type of eczema, but I work a lot with women who have similar issues with inflamed skin, or even like long-standing acne issues into adulthood. Those things are also all related to hormonal health, and is your digestion working properly to take in the nutrients that you need to have healthy, balanced hormones and healthy tissues. So Dr. Abby, do you want to go ahead and share some of the ways that you see digestive issues present in your practice?
Yeah. Well, I just want to stand behind everything that you said, which is so true. Big one that I was going to also say, I see a lot of digestive issues come out as skin issues also. A lot of the rashes, I take care of, I have a family practice, so I take care of all age groups. So we see a lot of skin issues and skin conditions coming from the gut, just the inflammation and kind of irritability of it. I also see a ton of people who have, depression, anxiety, attention issues, a lot of brain health, and with your mood and with your energy, having a lot to do with how your digestive tract is absorbing, which is such a critical. I'm so glad that we are talking about absorption, how your body absorbs, and or how I always say how angry your digestive tract is, which means what are you putting into it that it either loves or it just hates. So those are, I would say, the two big ones that I will see more of: emotional distress and skin issues. I even see, sometimes we'll see patients with a lot of low back pains that are actually from, which we'll talk about in a minute, with the direct connection to the nerves that go into the low back that control the digestive tract, are also controlling the muscles and the ligaments in the low back too.
Mm-hmm. Yeah, I'm so glad that you brought up the mental health aspect too. That's such a huge piece that we often forget. Yeah, forget to relate that back to, are we absorbing everything we need to create those neurotransmitters and all of that keeps us well? Yeah.
Big time. Big time. Yeah.
Awesome. And so another piece that Dr. Abby and I both really love when working with clients or patients is educating on how the body actually works. I think that that's really empowering. And I know for me in my practice specifically, again, I mentioned I help women heal their relationship with their bodies and with food. Part of being able to heal that relationship comes in understanding how your body works and starting to recognize that symptoms that you might be experiencing are actually just communication from your body. Your body's trying to tell you that something is off, or that something is out of balance. And so we wanted to just give you guys an introduction into really how digestion operates so that you can start to recognize those things and those patterns yourself. And so the first part is, I think we often think that digestion, when we think about digestion broadly, we think about our stomach and how well that's breaking down food. Or sometimes we might think about digestion starting in the mouth when we start with the chewing process. And those are very important pieces to digestion. But the thing that I really want to hammer home is that digestion actually begins in our brain. And so there's a huge connection between our nervous system, which is why it's so important that we have Dr. Abby here talking about this from a chiropractic perspective. But it starts in the brain, and our guts actually have their own nervous system, which you might see referred to as the enteric nervous system. I like to call it the gut brain. And so that just shows you how integral really your nervous system is to the digestive process. And so a lot of the topics that we're going to touch on today are kind of how to get yourself into a space where your nervous system and your gut are actually communicating appropriately to facilitate the digestive process. And this also relates to the fact that a lot of times, a lot of us are eating on the go, eating on a rush, or if we are regularly eating prepackaged foods, that can actually impair our digestion and cause more digestive symptoms. And then some of those other symptoms later down the road that we already mentioned, like skin issues, mental health issues. And that's because when we're eating in a hurry or eating prepackaged foods, our brain isn't really getting the signals that we're going to start eating before we start that process. And so the more frequently that you can actually prepare your own meals, and take time to sit down and look at and appreciate and smell your food to give your brain those cues of, okay, we're about to get ready to eat now, the easier your digestive system is, easier time your digestive system is going to have in starting that process. The other piece that I want us to touch on regarding how digestion works is that there are two main components of our nervous system. So Dr. Abby, you're the nervous system expert. Will you talk to us about that a little bit?
You betcha. So most of, well, the fancy terminology, just we'll get to the science nerd part of this if you'll let me geek out for just a minute. The nervous system consists basically of your brain, your spinal cord, and all of those nerves. Okay. And so these act as a telephone wire, just like Jess said, their number one job of the nervous system is to keep you in a very safe space. And so the communication back and forth is just paramount to be able to tell the body when to change, or like Jess said, prepare for food. And then also when that comes in, what do we do with it? So there are two parts of the nervous system that play a role in keeping you basically in survival. And they are your parasympathetic and your sympathetic. So you may have heard of those words, but most likely you've heard of the words fight or flight. Most people, when we talk about even going into the grade schools, we will talk about that fight or flight position that your body goes in, and or what we call rest and digest. And so those are the two different. And so when we put those in perspective, the fight or flight, when your body goes into a sympathetic response, that is, if we had an example of your house right now, or your office, or wherever you're at watching this, started on fire. If in order for your body to survive, or you to survive, or you to get out of an extremely stressful situation, certain things would have to happen. Certain messages from your brain would need to fire to certain organs. For example, think about how, if you were in a fire and you needed to get out of the house, would you want your blood pressure to go up, or would you want your blood pressure to go down? Like, do you want your heart at that point pumping blood very, very fast? Or would you want it to be kind of lackadaisical and chill? You know, in order to survive, we need that blood pressure super high. We need your pulse super high. We need digestion. If you think about it, when you're in fight or flight, if you are trying to survive, what should our digestion do? Should we be using all of that energy to digest food, or should we save that and put the energy to somewhere else to survive, right? It makes sense. So our brain knows exactly how to survive. Now, in fight or flight, digestion goes down. So in the sympathetic mode, the digestion goes down. When you think about it, though, you get out of the fire, you are safe, your family's safe, your cat's safe, everything's good. Your body then transitions back into parasympathetic, which is more of your rest and digest. So messages now will get sent to different parts of the body to say, I now can bring back down my blood pressure. I can bring back down my my heart rate, And now I can focus on other things. And so you will fluctuate all day long. Now, listen, you guys, in America or wherever you're listening to from here, our houses don't burn down every day. We don't have lions attacking us every day. But Jess had made a comment earlier about eating on the go, eating processed foods. In 2020, our bodies do not know the difference between a house fire and a crazy coworker that drives us insane. Doesn't know the difference between a tiger and a pandemic. All it sees it is as some form of either fight or flight or rest and digest. And the problem comes in, and Dr. Jess will be talking a little bit more about this, is that majority of humans, and I will say humans, because I think you may agree with me, Dr. Jess, that globally, this is a big problem that many humans are stuck and or live in a sympathetic or fight or flight nervous system response. And so they never or very hardly get into the rest and digest. And so that literally, you can't be in both of them at the same time. Your body will fluctuate or will stay in one longer and then come back into there. They are opposites, and they're meant to be opposites. And your body is meant to be in them. And the goal is to stay more parasympathetic or rest and digest than into the sympathetic. And we'll kind of talk about that in a little bit here, how we kind of flip flop back to that parasympathetic mode.
Perfect.
So you can keep talking about that glorious vagus nerve that we both love.
Yes, thank you so much for that beautiful description of the parasympathetic versus sympathetic. That was perfect. We just want to highlight for you guys and give you like a little bit more of a visual of that gut and that brain connection, right? So digestion starts in the brain. We've established we need to be in a rest and digest mode, so not super stressed out. But what does that actually look like on a physical level? So we've got this image here, and I know there's a lot going on the image, and the details of it aren't super important. I have a couple of pieces of it highlighted though. So there is a giant nerve that runs from your brain to your gut, to your digestive system, and that is called the vagus nerve. And the vagus nerve itself is truly the gut and the brain connection. And as you can see in this image, I've got a green arrow kind of pointing to where the vagus nerve starts, and then a green circle around all of the organs that the vagus nerve connects to. And so this is how the brain communicates to those organs. So you can see we're looking at the stomach, the liver, the gallbladder, the pancreas, the intestines. These organs are all huge players in the digestive system process. And a lot of them actually secrete digestive enzymes, chemicals to help break down proteins, fats, and carbohydrates, which that point will come into play a little bit later when we talk about some recommendations for how you can optimize your digestion. And so I wanted to highlight this nerve because you might hear, if you start to get more into researching ways that you can optimize your digestive health, you might hear the term vagal tone. And so what that's referring to are strategies to improve vagal tone are really strategies that help facilitate the vagus nerve to communicate from the brain and to the gut. And so connecting back to what Dr. Abby was just saying, the vagus nerve is a parasympathetic or a rest and digest nerve. And so we need to be in a relaxed state in order for that nerve to be able to communicate from the brain to our gut and facilitate the whole digestive process. And so we can, yep, perfect. And then just to kind of summarize everything that Dr. Abby and I have just said is that when we are stressed, we are in fight or flight mode. Therefore, our body is not prioritizing digestion. And to Dr. Abby's point, our bodies are incredibly wise. However, we only have one stress response. So whether you're truly in a life-threatening scenario, like Dr. Abby was saying with your house being on fire, or you're sitting in traffic and you're just really annoyed because traffic is backed up, your body can't tell the difference. And either way, your body is going to be in that fight or flight mode. And so when we are constantly in this fight or flight, highly stressed mode, that leads to impaired digestion. So we have decreased nutrient absorption, which increases the likelihood of digestive symptoms like we've mentioned before, and also increases the likelihood of related symptoms later down the road, like we've already mentioned, including hormonal balance, mental health, skin issues, and some key symptoms that I would like you guys to start looking out for and start recognizing as communication from your body that something is out of balance in terms of your digestion are listed on this slide. So things like bloating, gas, especially within a couple of hours after a meal, diarrhea or constipation, and really the big one is undigested food in the stool. And so I know that talking about bowel movements can be uncomfortable. It's something that I talk about a lot with my clients because it's a huge indicator to how well your digestive system is working. And one of the biggest signs that your digestive system needs a little bit of support, again, is having that undigested food in the stool. So with all of that said, let's go ahead and get into some of the simple strategies that we can use to start to improve our digestive health. And so the first two that I have listed here seem really simple. In fact, all of these are really simple, but they're incredibly impactful. So I just want to preface this by saying, if you are someone that currently experiences like bloating, gas, diarrhea after meals, and you start implementing these things, I can say with confidence that you will likely see a significant decrease in some of those symptoms within a couple of days. Now, that doesn't mean that it's taking care of the entire issue for you. And so, you know, I definitely recommend, if you're having issues on a regular basis, reaching out to a practitioner. But the point is, these strategies can be really impactful. And the first two strategies that I have here are strategies to help enhance vagal tone. So we're getting into that rest and digest system within the nervous system and allowing open communication from the brain to the gut. And so something really simple is doing some deep breathing before your meals. So when you've prepared a meal, even if it has to be a prepackaged meal, fine, go ahead and sit down and just take 3 to 5 deep breaths to start getting you into that relaxed state and enhance that vagal nerve communication. Another practice that you can do is simply to practice gratitude for the food that is in front of you. A really easy way to start implementing this is to make more of your own meals. And so the process of actually cutting, cooking, and plating up your food, again, those visual signals and the smells that we're experiencing from creating that food, even like the tactile, the touch of chopping our food and throwing it into a sauteing pan, all of that gets our brain ready to start digesting food. And so if you can do that process, express gratitude for the food you have in front of you. I often will sometimes sit with a plate of food and just think about, like, where did all this food come from? You know, was this some stuff that I grew in my own backyard for which I can be thankful for myself for doing that work? Or did I get this from a farmer, like a farmer's market or some local grocery store that I really appreciate? Where's my food coming from? Who put in the energy to create this food or grow this food? And can I just express gratitude for them? Another strategy to help improve your digestion is to chew each bite of food at least 15 times. And so ideally, when we swallow a bite of food, we want it to be like a smoothie consistency. It should be easy to swallow. And we've probably all either experienced or eaten a meal with someone who tends to gulp their food and take big drinks of water to get it to go down. You don't want to have to do that. You should be chewing your food well enough that you don't really need to take a drink of water to choke it down. And the other piece about chewing at least 15 times is that our saliva, so our spit, actually has some of those digestive enzymes. So I mentioned that some of the organs in the digestive process contain enzymes that break down our food. So does our spit. And so the process of breaking down especially carbohydrates and fats, that really starts in the mouth. And so we can be really gentle on our blood sugar regulation and really gentle on those digestive organs by really chewing our food well and getting that breakdown process started. And then my final recommendation for you guys to take away is that you can prepare yourself for a meal by having 1 to 2 tablespoons of either apple cider vinegar or lemon juice mixed with about 1/2 cup of water. And you can have that beverage about 10 minutes before you're planning on eating your meal. And what that does, those bitter flavors in the apple cider vinegar or in the lemon juice actually stimulates those digestive organs. So I mentioned back on the vagus nerve slide that there's a group of organs that secrete some enzymes like the pancreas and even the intestines that help break down food. So bitter flavors actually stimulate the production of those enzymes to help break down our food and again, just really gently support our digestive system. And I know, Dr. Abby, you've got some recommendations as well, so I will let you take it away.
I love it. If you don't mind me making one more comment, when you were saying about the tactile and when you're creating your own food and smells and touches, remember those feelings, those senses come with feelings. And so when you appreciate your food, that's a feeling that the nervous system takes in. And most of the time, if I said the word fresh baked chocolate chip cookies, we know they're not the best food, but you know that feeling that comes along with it. When we get into that gratitude and those smells and those touches, that again will take us, just like you said, into parasympathetic, which is amazing. So I don't want people to underestimate that statement and how powerful that the nervous system can respond, good or bad, in milliseconds. And so even if you were on the go like crazy and in a sympathetic or fight or flight, and you take that small amount of time, it will literally flip it into that more rest and digest. And that is so important. So I'm so glad you mentioned that. I talk about a lot of times with my patients and people I'm talking and helping with digestion is the posture and position that you eat in. And just like Dr. Jess said, most people or a lot of people will either eat on the go, eat in their car, bent over their computer, snacking on the way out, driving a car, whatever it is. We have to remember that the brain, as we started this whole concept, that the brain is the powerhouse that will allow messages of this getting you into the parasympathetic rest or digest and getting all of these organs ready. And so when your brain can communicate perfectly through and all those organs can send messages back up to the brain, posture has a huge part in that. Our spine is the bones that protect all of those nerves. And for what it is good and or bad, they can protect it, but they can also be very damaging on those nerves. And so when you go into a hunched position, when you're going into a bad computer position, what actually happens is you can start to not only take those organs and squish them, which makes it very hard for mobility of the gut and gastric squeezing to happen or our stomach squeezing to happen. but the actual nerves, when the brain is trying to fire to say, create this enzyme, digest this carbohydrate, move that into the gut, those messages can be disrupted and or in fact mangled. And so now we have a digestive tract and organs that are not getting proper signals or communication to the brain solely with your posture. So I am a huge proponent of making sure that when you are eating, obviously taking those couple deep breaths can just get you back into a mode of eating, but staying very upright, keeping your body in a very strong upright position and not hunched over. It's one of the main reasons why I don't like people eating in front of the TV or on a TV tray or with their cell phone, because of the physical aspect of that. And so physically that can make a big difference. One of the tools that I have been teaching and started to teach some people with acute issues. Now, I am along with Dr. Jess very strongly saying to you that these are some of these fixes that we have been talking about can help you go only so far. Just because it makes the symptom go away does not mean that you don't need further help to be able to fix long-standing chronic either physical issues and or emotional issues and or nutritional absorption issues. So with that being said, I'm going to tell you about this acute trick, but this is not the answer. If you are continually having these gut issues, you do need to reach out to either one of us or both of us to be able to find the more underlying deep chronic cause to this. But there is part of your digestive tract that attaches your small intestines to your large intestines. So we have a gut, and that's this picture over here. Our gut is a stomach, and as the stomach goes into the colon or the small intestines, they're two separate pieces. There's an ileocecal valve. It's a very fancy word, but I'm going to use my little doll that I have here in the office as a precursor. Sometimes what happens is we find, especially sometimes with nerve impingement, with poor posture, with all of these things happening with inflammation, this ileocecal valve, which is just an opening. It's a valve that opens and closes. And this valve can either get stuck open or stuck closed. Most of the time it's closed, which means that a normal flow of food cannot happen. And that will create constipation, bloating, some of this backup. And so there is a massage that you can do on this ileocecal valve to get you through an acute problem. Again, this should not be a chronic answer. This should be something that if you are in a lot of pain right away and you need to try something. I would also advise before doing this that you talk to a professional in person with this. You know, we do these for educational purposes. This is not to diagnose anything. It's just to kind of help. So if you are having issues, make sure you talk to someone who knows what they're doing, AKA one of us in person. But so with the ileocecal valve, this ileocecal valve, sorry, I've got to get is on the right side of your body. So you're going to find your belly button, and you're going to find there is a bump on your hip here. You'll feel it. If you just rub around on here, you'll feel a bone. So between your belly button and your hip, about halfway in between there, that's about where the ileocecal valve is. And the goal with this massage, it's very, very simple. You find that area, you take your finger and you push in and you give pressure. If this is the problem, you will find that this is painful. It should be painful if the ileocecal valve is stuck and or inflamed. So you will put pressure into that ileocecal valve for 5 to 10 seconds. Then you will start to massage it clockwise. Then you massage it counterclockwise. So usually I will say 10, 15 times clockwise, 10, 15 times counterclockwise. Then you will massage along the colon. The colon is what makes your bowel movements come out of you. So you will go up till about your rib cage. you will go across your rib cage, and then you will go down on your left side. And that's that. Most of the time when people do this, what they will find is either an instant relief. You may almost have some passing of gas. You may feel just some instant relief, and or within 5 to 10 minutes, you'll get some form of relief with that. But again, this is not the long-term answer. This is more for acute. So again, the ileocecal valve between your belly button and your bony protuberance on that right side, you come halfway in between, you push in 10 seconds, you massage clockwise 10, counterclockwise 10, and then you do the colon massages where you go up on the right, across over into the middle, and then down on the left. That is a great strategy to be able to use to help with that. So anything else to add there, Dr. Jess?
I don't think so. I love this strategy of the massage. That was something that was new to me that you introduced to me. So I'm very appreciative of that. Yeah. And I would just say, guys, questions, if you have questions, put them in the chat so we're coming up close on our Q&A session. So let us know what you want to know.
Yeah. And like I had said, both of us are here for really one reason and one reason only. We know that this is happening to way too many people. And we know that both our practices have seen phenomenal results with helping people long-term, not only get their gut healthy, but get their overall bodies healthy. And so we want to be advocating here for you guys. We want to be helping you. So yeah, please, if you have any question, whatever it may be, big or small, put it in the comments so that we have the opportunity. We're both going to put up our ways that you can get a hold of us and ways that we can help. That's our number one goal. After you watch this or after you spend some time with this, we want to make sure that we are here always for you guys. The best way really for me, again, I've been in practice. I have my own practice. It's called Health from Within. Over on Asbury Road. I've been here for 13 years and hope to go for another 30. So we are always doing nervous system evaluations to actually detect the pressure or interference with that brain-body connection, to actually see where inside the nervous system the stress lies, to be able to talk to you and teach you how to get that out of you so that you can communicate internally with everything from there too. So anybody who does watch this and does decide to come into the office or get an evaluation, what I will extend is a 60% discount on my initial exam with that. So in order to do that, you'll just have to call the office. And when you call the office, just make sure that you tell them that you watched the webinar with me and Dr. Jess, and we'll honor that 60% discount off of any exam and x-rays that you would need. So that's all of our information on there. We are going to have this stay on the Facebook page, and then that way you can get it, and it will also be on YouTube. So if you don't have a chance to write this all down right now, you'll be able to come back and walk through all of that and get the information again. So
perfect. And
Dr. Jess, what did I do? Oh my gosh.
It's all good.
Okay. No, it's not. I was the one in charge of this, and I don't know how this happened. Okay, give me 2 seconds and I'll find all your stuff and put it back up. Okay. Can you start working on questions and such, and then I'll figure this out?
Sure.
Okay, I'll do it that way so that I make sure I get all your information.
Yeah, perfect. Okay. So I don't actually see any questions in the comments yet. So while you guys are brainstorming some questions that you might have for Dr. Abby or I do have some other information that I can share with you just that I think is interesting. So we talked on how enhancing that vagus nerve communication from the brain to the gut is really important to improve our digestion. Another way that we can do that, which is actually, I think, really beautiful, is through talking. So just the act of speaking or humming or singing actually enhances that vagus nerve communication. And so that's why it's really important to, when you can, share meals with people that you love to be around, your family, your friends. That helps to enhance digestion just in and of itself. And something else to note for anyone who's watching this that might have little ones or kids, if you happen to notice that your kids are like dancing and humming while they're eating at the dinner table, I hope that after watching this, you will actually allow them to continue doing that. It might seem like they're just messing around and playing around, but they're actually, unbeknownst to them, they're actually naturally enhancing their digestion and then therefore their health. So just another little tip is to like let that be and have conversations while you're eating and enjoy that.
I love that. Okay, now it's getting all messed up here. So I'm almost there, but give me a second.
It's all good.
Why don't you talk, Jess? Why don't you talk about, oh, there's part of it. Why don't you talk about the forum, the form that they can do while I figured this out on your website that they can click onto. Let's see, I am so sorry about this.
It's okay. Yeah,
Let me
so
put that there.
Yep, perfect. Okay, so I do see a question that popped in, so I'll get to that in just 1 second, Jenny. So through my practice, like I mentioned, my goal in life is to help women heal their relationship with food and with their bodies. And so I do this through a program called the Ending Emotional Eating Program. And in this program, it's a 12-week intensive. In this program, we work on stress reduction strategies. We work on helping you reframe the way that you see your body and the way that you approach food choices. And then we also work on topics like optimizing your digestion and a special piece of content that I love to teach, which is nourishing back to safety. So how we can start to reframe the way we think about food and using food really therapeutically to help us heal both from a physical and a mental perspective. And so there is an application for the Ending Emotional Eating program. If you think that that sounds like something you might be interested in, the link that's currently being presented by Dr. Abby right now is the link to that form. And it's also on my Instagram profile. And if you were just interested in getting it from me, you can email me directly. And I'll have my email and my Instagram handle posted up on the slide as soon as Dr. Abby gets it posted up here.
Oh my gosh.
That is what the form is. Do you want to just download it again from Canva? Because I looked at it earlier. Or is that the issue?
Right. It's the issue. That's the issue. So we're going to just put the contact me right there. That should be showing. I'm so sorry. You guys, this is my technical difficulties.
And you know what?
It won't let me.
We're going to post the PowerPoint slides to the Facebook event. And
you at least see the contact me.
Yeah. Yep. So there's my email. So one of the good ways to contact me is my email at thenourished@gmail.com or on Instagram. So my Instagram handle is at thenourished.farmd. So you can contact me there. You can message me directly on Instagram. You can send me an email and I'll send you a link to the application. The other thing I wanted to mention too is that anyone who watches this presentation and mentions this presentation to me, either directly or in the application form, you can just put a note that you were here or that you watched the replay, and I'm offering a 25% discount on the program as well. So definitely reach out if you think that that would be a good fit. Okay, Jenny, so it looks like Jenny had a question about, can you talk about the effects on how it affects your monthly cycle? I love this question because really healing your monthly cycle or healing your period is, that was part of my health journey too. And it continues to be. The health journey never ends. I don't mean to make it sound like I've like achieved ultimate health, because it's always a process. But that's something that I work with women on a lot, is optimizing your cycle and using food therapeutically to do that. So There's a lot of ways that that can be done, but the digestive process, just like we mentioned at the beginning of this presentation, we need to optimize our digestion in order to be able to adequately absorb nutrients, vitamins, and minerals. And there are a lot of key nutrients. Magnesium is a huge one. Also, healthy fats are a huge one. Those are essential for having healthy cycles. Those are essential for ovulating on a regular basis. So ovulation is the process of actually releasing an egg and then having your menstrual cycle. And unbeknownst to a lot of women, that process of ovulation or releasing an egg is vital for mental health. So we release a hormone in that process called progesterone, which is a huge mental health boost, among other things. We want our bodies ultimately to be working well. And even if you're not interested in having a baby, ultimately, in order to, I guess, one measurement of ultimate health is your fertility and is your menstrual cycle. So the menstrual cycle has actually recently been referred to by ACOG, which is the American, I think, the Academy of Clinical Obstetrics and Gynecology. So the head people in the country that talk about women's health and childbirth and things like that. The menstrual cycle has been recognized by them as the 5th vital sign. And so having a healthy, relatively pain-free, relatively consistent menstrual cycle is a measurement of health. And again, absorbing vitamins and minerals from our food is part of the way that we get there. Also reducing stress, which is really part of this discussion that we're having. So everything kind of connects. So Jenny, I hope that that answers your question. Let me know if it doesn't, if you want some more details on that. And you can also definitely contact me directly through, again, Instagram or my my email if you want to talk in some more detail about that. And it looks like you have another question from Nora. Dr. Abby, do you want to start with that one?
Look what I got. I got it back up.
Hey.
There you go.
Perfect. Yep. So like I said, we will special discount of 25% on this Ending Emotional Eating program. If you think you would be a good fit for that, the link to apply is there, and we will upload the slides for you guys to be able to access as well.
Yep. Looks like there's one other question on there from Nora. It says, what's the most likely cause of having alternating bouts of constipation and normal movement when diet doesn't significantly change in its content and quality? You want to take that one?
Sure. The first thing that comes to mind.
It could be a couple things, I think.
Yeah, for sure.
Yeah.
It's again, we've kind of already alluded to this. It's hard for us to know, obviously, what's happening with you if we are not your practitioner. But in general, when someone is presenting with that kind of inconsistency, my first question is, what does your eating environment look like? Meaning, are you eating on the go? Are you rushed? Are you eating at work in front of your computer screen? Are you highly stressed? Those things would be contributing to inconsistency for sure. Dr. Abby, anything to add on that one?
The only other thing that I would add is sometimes constipation can also come from lack of water intake and or food sensitivities, which is a whole nother topic. But I would agree. Yeah. I mean, unfortunately, Nora, this is the hard part. Like she said, there's probably 20 of them we could list right now. But your basics, I would agree, like your top ones, we got to be watching water intake, sometimes with people who are drinking while they are eating, their enzymes are not actually functioning. The water is what's breaking it down instead of an enzyme that the body naturally creates. And so if that's not the food's breaking down properly, it will kind of get stuck or meshed into the gut. So that could be an issue. So I always tell people you could drink water before and after, but usually not while. And so again, same concept. If it's stressed out while you're eating, what's the activity level kind of, or what's your environment while you're eating is a big thing. And or your body just may not be the food that is good for you. And so it does not know how to break it down. It doesn't have the proper communication, the proper help to be able to break it down. So that can make a big problem too.
Yeah, the only other thing that I would add maybe is, since we kind of talked about it on the last question, is if you are menstruating, if you're currently having menstrual cycles, where are you in your cycle? Because that can cause some diarrhea and some constipation to occur based on hormone fluctuations. And also our inflammation in our body tends to increase if we're not really well nourished prior to our menstrual cycles starting. So that can be like a common PMS symptom, is to suddenly have some constipation or some diarrhea when you didn't before. So again,
what would you say about postmenopausal people then, or postmenopausal women? Because then the hormones are completely different with that.
Right. And I think usually that's part the changes that happen hormonally after and during menopause usually cause constipation to be more of an issue. Certainly both can be an issue, but that low level of estrogen can actually increase constipation. And so there are, honestly, this is probably true for you, Dr. Abby, almost all the work I do relates in some way back to reducing stress. And so that's what I was going to say, is in terms of someone dealing with those issues during or after menopause, one of the best things you can do to support your body is find ways to reduce stress. So deep breathing, meditation, going for walks, and then also using food therapeutically to help reduce stress on the body. So yeah, I hope that helps.
Yep, stress plays a role in 99% of problems.
Yeah.
That's the hard part. Cool. How about any other last minute questions or concerns you guys have? I don't see any more shooting up there, so I think we might be okay for now.
Cool. Well, yeah, everyone just know that, like Dr. Abby and I have mentioned, we're both open to conversation and questions. So contact us. We will get these slides uploaded for you guys. And honestly, too, if you guys have any topics that you would like us to get on here and discuss again on a future date, just let us know and we can try to put something together. I see another question just popped in from Jenny. Keto diet, wondering if it's a good idea. What's the last part of the question?
For the digestive system. So is keto diet good for the digestive system?
You
want me to start on my thoughts? You can take it?
Yeah, you start on yours.
I think, when we talk about the keto diet, if you don't know anything about the keto diet, it is a high fat, high protein, kind of low carbohydrate diet plan. It is well known that carbohydrates are the easiest to digest in most senses of when we talk about proteins, fats, and carbohydrates. They are very easily to be digestible. Where we get into the proteins and the fats can be a little bit harder. They can kind of use more systems of the digestive tract. And so they can be hard. Sometimes I think, honestly, Jenny, more importantly about the keto diet is the quality of food that you're eating on the keto diet. And I don't think necessarily it has to do with the keto diet itself, but the types of proteins and fats that you're eating on that diet. It's very easy to be keto, but quality of food very minimal. And that will always be hard. Just like Dr. Jess said, it will always be hard on your digestive tract versus having a keto diet that is very high quality, low processed, low chemical, low artificial. That will be much easier for your body to digest. So I think the bigger picture is quality of food versus kind of keto versus no keto. I hope that makes sense. Would add anything into that, Dr. Jess?
I would. I was just trying to organize my thoughts because I have a lot of them on this topic. And so I have a personal history with like using the keto diet too. And I have, I think all of us have probably like gotten on the low carb train at some point. But what I've learned over the years is it's actually, there's a lot of reasons that I don't generally recommend a hard and fast keto diet, and some of them do relate to digestive health. And I also want to just give some clarification too. A keto diet specifically is like really, really low carb. So we're talking less than 5% of your daily calories are carbohydrates. Now, the healthy level of carbohydrates can actually vary from person to person quite widely. So we're talking from like 22% to up to maybe 45% of daily calories. So I think that there's often people fail to make a distinction between a low carbohydrate diet and a keto diet. You can eat lower carbohydrates, like around 20-25% carbohydrates is a little bit of a lower carb diet, but that's not keto. Keto is a severely low carbohydrate diet of less than 5%. I, again, focus on women's health, and I see a lot of issues hormonally in women that have been on the keto diet long term. One of the big ones that kind of relates to digestion and health is that our thyroid, so we have a gland in our throat called the thyroid. It does a lot of things. Literally every cell in our body has a thyroid hormone receptor. So that tells you how significantly thyroid health impacts our overall wellness. But the activation of the thyroid hormone in our body from an inactive form to an active form requires carbohydrates. And so what can happen if you are on a very low carbohydrate diet for a long time is that it can downregulate your metabolism, or basically slow down your metabolism over time due to stress on your thyroid and your body not being able to really activate that thyroid hormone. And so that can cause, low metabolism can cause slow digestion and can cause constipation. And another thing, keto can be, like Dr. Abby mentioned, it's really high fat. And if it's high quality fat, that can be okay. But the issue is eating all that fat drowns out some of the protein that you might otherwise be consuming. And if we are, for a long period of time, not getting enough protein, our body can actually down-regulate or decrease the amount of stomach acid that it produces, which then leads to long-term issues of breaking down food. If we don't have enough stomach acid, we can't, we can't start that digestive process in the stomach. And so I've also worked with a lot of women who eat low protein or eat like a vegetarian or a vegan, more type keto diet, and then end up having issues digesting protein later down the road. So probably more information than you bargained for, but there's a lot of moving pieces with that. Yeah.
That could be a whole nother workshop that we do.
Yes. Cool.
Wonderful.
Well, I think that wraps it up. Again, reach out to either of us if you guys would be interested in working with us or just have more questions and want to discuss more topics. Definitely let us know. And we appreciate everybody's time today. So thank you guys, and have an awesome week.
Thanks, Dr. Jess.
Yeah, thanks, Dr. Abby.
Yeah. See you guys later. Bye.
Yeah.